This office is one that we have. It's the best value. The sale price of this office is extremely moderate, affordable, and the best value because the equipment alone costs as much as the price of the office. And you're getting a full entire office. And I'm talking equipment like only two or three items cost as much as the price of the office. But this scenario is a great opportunity for a business person that wants to run a dental office with a great barrier entry level industry, has existing clients and been in operation, and it has a track record and proven income. And the story behind it is, well, the dentist is retired and the other dentist that did work there passed away. So it's allowed this opportunity to evolve. Now, this has 8 exam rooms, fully furnished operating office with 5,400 square feet, 2,700 square feet up front. On the top level, 2,700 on the bottom, with a full dental lab. And I'm going to go over all the equipment and everything and the services in this facility, which is incredible. It has a great income potential. And the beauty of this office is that you're able to get all of your services done for the teeth replacement, prosthetics, etc., dentures, partial, full fill, whatever, all in the same day. And another reason why that is so amazing, because the laboratory alone can outsource and bring in business from other dentists in the area, and it hasn't really been fully capitalized because the two dentists that work there were kind of working part-time in a way, and they weren't really expanding it, but it did make a lot of money. And partly also had run into COVID decrease in income because of COVID. But as we all know, that fake scam COVID and the fake virus that they made and the et cetera, well, that shutdown type of scenario is not going to exist anymore, especially if you know what's going on. Anyhow, so that alone, so these things and the retiring all added up to where we are now. This here has the main equipment that is worth the price of the office is the CO2 laser and the CAT scan panoramic X-ray cone beam 3D imaging, which I'll go over all this stuff in more detail and why they're important and how it's going to benefit the practice. I mean, if you're a dentist, you already know these things and you already know the quality and the caliber of equipment that it brings to the table and what you can do with it. So this video is for business people that want to buy it and or dentists that are looking to buy it as well. The average equipment on here, chairs, etc., and everything is about 10 years old. The dentist will stay on during the transition period. He does own the building, and the building will have a property rental of $4,500 a month, and that is first floor and lower level with the full dental lab in the basement. And I'm going to go over all the pictures and the general tour of the office, as you'll notice right here. That picture, the couches probably need replaced, and painting, we could do that. We'll work that out, have things taken care of. The average income on this property from basically a 5-year history, you're looking around an average of $700,000 a month on doctors that really were not pushing it to the extreme and not really trying to capitalize on all the income and just making a good living. So when we talk about the prices, the value of this thing and how much potential it is, it pays for itself, and it isn't even going to be long. So we are looking for a cash buyer and a quick sell right now. But if you want financing on other practices, which I have, I can do the financing also. Now, why this office makes so much money is because of all the services that it can offer. I mean, you're talking about prosthetics, bridge, partial dental crowns, permanent implant features, top and bottom replacement on the same day, multiple tooth replacement, extraction, occlusal adjustment, bone grafting, ridge augmentation, ridge preservation, the sedation, and the tooth extraction and the wisdom teeth extraction. Has a receptionist and a full-time dental hygienist. The income history on this is, well, start out 854, 844, 700,000, 19, I don't have the paperwork for, but 20, 20, 21, we have the COVID scenario and other dentists passed away. So you're looking at basically one dentist part-time. And, as all dentists get to that age where you want to retire and spend more time with your family and doing things, that's why. So it's actually a great income opportunity. It can make a lot of money. Active clients. I'm going to give you a list of active clients. Right now, just on the part-time basis, you're looking at a really decent setup on the client list of active clients. You have 3,000 male clients and 4,500 female clients. So, like I mentioned in my other video, I mean, the average amount of clients per one dentist that makes a good living is 2,900. So you're looking at well over that per dentist, and as well as the fact that one dentist is in an operation now making this kind of money just says how much more money it can make if you put in two, as well as if you put in a full-time dental technician that does all the implants and builds the teeth and all these things like that and does the outsourcing. The income on it that it generated was mainly from this practice alone, but it can, since it does all your implants and all the procedures and everything made in the laboratory in one day, which a lot of dentists cannot do it in one day and get that kind of type of return, is such a high value and has so much potential. So you have a dentist that worked the clients and another dentist that worked the clients and did the dental lab. But if you actually had a dental lab person and two dentists working clients, it's going to make more money. And you have two dentists that are both completely full-time all the time, or you have it filled up to three dentists, it could make anywhere from $1.5 to $3 million a year, easy. And this breakdown of active clients, you have insurance clients of 4,300 and ones that don't have insurance is 3,500. But I mean, that is a strong base to start going and making money on. So, like I'm saying, this is a good opportunity. I'll go over more of the inventory later. Has a vac system for the dental work and stuff, security cameras, all that. I'm going to go over that later. Okay, so now let's go over the equipment. The equipment that is important and makes the money. You have the cone beam, CT scan, 3D imaging, panoramic, CAT scan, which will do 3D imaging and digital imaging for x-rays and allow for quick x-rays. It's not like a film x-ray in the past where you get more exposure and it's less radiation. It is good and fast and allows you also to save it on computer and then get other opinions if you needed or transfer this to other doctors as well. So for COVID diagnosis and replacement of dental implants and having exact fit for the dental implants as well. So this equipment plus the laser, which I'm going to go over right now, this CO2 laser, which is the latest in technology for basically pain control. You can have a laser go through the surface of your gums, only hits the first 1/10 of a millimeter of depth, and it's with the carbon dioxide. So it's the wavelength and the hertz of it is going to allow you to not feel pain, have a faster recovery, and be able to perform all this stuff. Replace dentures or bridges or crowns or extractions and all this things in one day with no long-term surgery recovery, less pain and less stress, and improved treatment. So that plus the panoramic scanner for the x-rays, I mean, those two alone basically cover the whole price of the practice, because you're going to have to, if you start a new practice, just buying that stuff alone, it's going to cost as much as this practice is selling for, but this is going to be a quick mover. The dentist is motivated, and we want to move it as well. The other ones that we have are larger and more expensive, but this one I'm going over in highlights so everybody gets an idea what's there and what's available. They do oral cancer screening. Just going over part of the services. They have this Nobel Prosthesis Systems prosthetics production. This thing is state of the art. It can replicate any oral layout that you have from x-rays and everything from digital pictures and maximize the fit. So it could be the perfect fit and the perfect prosthetics in the same day, and you don't have to go anywhere with no teeth, all that kind of stuff. So all this laboratory stuff and these equipment alone, not to mention all the equipment in all the rooms, which I'll go over in the end, is so much worth the value. It's incredible. Now, if you're a qualified buyer and you're a dentist or whatever, and you want to get more details, copies of everything in more detail, and set up a tour, we have paperwork and can get all that to you. This is kind of like a highlight, condensed, short video to let you know what everything is all included into the price of the sell this practice. Now, here's a close-up of the Nobel scanner and the prosthetics 3D imaging production for the prosthetics in the lab. This is a laboratory. I have better pictures as well. More of the laboratory, and also we have more of the equipment, and these are closer pictures. As you're drilling in one of the exam rooms, and well as your carbon dioxide laser. Now, these are pictures of the office as well, and I want to finish going over the office on the tour in the video right here. This video, I can increase the size, and we'll go over that. And then I'll go over a list of full inventory for exam rooms. Now, there's 8 exam rooms, so you can definitely have up to 3 dentists in this office, and it has parking. It's the entire building, as well as the dental lab beneath. Here we go. And what you're looking at is the office here. There is also a room for billing and insurance as well. Let's see, I'm going to show you what else. Break room, exam room. There's your 3D cone imaging x-ray right there. And then back to the office reception area. I want to show you the billing right now. The billing area for insurance is on the next video. Just take 1 second. Right here, it's kind of a fast video. It's a decent size little office for insurance and billing. Nice to keep things organized. So that pretty much goes over the practice. I want to go over the details of the inventory so you know what you're getting. If you contact me and you're very serious and you're very interested, I'm going to go over the pricing, which is you're going to actually be impressed and shocked by the pricing because it's priced very modestly to move it fast. Dental equipment inventory. Of course, you have the reception area, like we showed. The corner lighting, water dispenser, magazines, front desk, computers, wooden cabinetry and everything. Room 1, you have the chairs, your stools, operatory lights, cabinetry, Pinamix 3M impressions, all of your dental equipment. These are all fully furnished offices. Room 2, your stools, Cabotron, operating lights, x-ray, tubs, trays, etc. And x-ray apron as well. 3, the dental chair, operatory lights, etc. All these things. I think all the chairs look okay. I mean, you can always update a chair if you want to modernize it. Definitely the office in the very front, the patient area, maybe those chairs could be replaced, but that's all very minor stuff. Room 4, Cabotron, cart, x-ray apron again, computer. And room 5, stools, assistant stools, operatory, cabinetry, Zoom machine, cancer screening. Room 6, pretty much similar, x-ray again, tubs, tray, all that kind of stuff. 7, operatory, cabinetry, tubs, trays, tools, dental chair. Room 7, stools, intraoral x-rays, tubs, laser machine, implant machine, nitrous oxide, oxygen, x-ray, basically your operating room. And you have your NSX IT Max high-speed machine. Room 9, you have your 3D iCat scanning, your printer, intraoral chick sensor number 2, small laboratory, your dark room, sterilization area with the autoclave cabinet, and various pieces of equipment. Back office, tables, chairs, 2 computers, and office supplies. Manager room, cabinet, computer, scanner, etc., refrigerator, humidifier, microwave, break room, basically. Manager room, computer, all this, storage room, doctor's office, personal computer, etc., evacuation pumps, and security camera. So now, like I said, if you're a cash buyer, this is good priced value, ready to move. And doctor stays on during transition, so it has tons of capacity. It has capacity to service other dentists in the area, to get one-day services on dental labs, because most dental practices, a lot of dental practices, always outsource the dental laboratory stuff because they don't have it in-house. This is in-house, so that alone makes it worth a lot of money and bring in exponential money, as well as if you have added 2 doctors full-time doing patients versus what it was previously, 1 doctor doing dental lab and patients, you're going to make more money. And the fact that it's basically 1 doctor making part-time, and prior was basically 2 doctors making part-time. So basically you can pay off this whole practice and everything for what it was barely working at in 6 months. And as well as if you want to add on additional services, or you want to do emergency services, or all these other things. And like I said in other video before all this, we have a management team, basically a business management team for the dentist with high levels of experience, up to 100 years combined experience, like I mentioned before, which is a turnkey operation to basically quadruple the income of any practice. So this practice has the potential to make easily $1.5 million to $3 million a year. And the dentist is the owner of the building. So he's going to be there in the transition period, and you're buying a practice that he is the owner of the building on. So he is not going to set you up to fail. And what he's going to say is not going to be a lie, because you have to pay him rent. And it's a win-win interconnected partnership for the long run. So you really have no way to fail. If you're interested in getting in this opportunity, whatever, give me a call and we can look at things and go over, get you more paperwork and the details, and go over things and get things started. Or if you want to get in commercial real estate and get into the really big money, unlike anybody else does on the internet, that would be great. Give me a call as well. Or if you're at the bottom, you don't have any cash, you want to move forward, you need to get credit repair or personal funding or corporate funding, yes, definitely give me a call. So thanks for watching. My number is 312-473-4163. Thanks a lot.